They've been obviously a very key implemented in starting it up, so obviously they've helped us obviously firstly teach us instructions how to use the equipment, provide us with the equipment, so we're knowing what's going on with the equipment and knowing if there's any technical issues we can actually help. But also obviously they've given us and helped us because they know obviously a lot about a lot of the medical conditions with the gentleman that Kevin has asthma, so he can talk a lot about some of the conditions and how it will help their conditions, which I think has helped. And they've obviously got other areas which they can bring in to do with promotion, so obviously through their own social media, or obviously Kevin's quite a keen advocate, he goes down to London and delivers talks and things, so he can promote on what we're doing and sell it to other services. Within the council itself, obviously Dan's helped set it up, so that's been great. But obviously, we recently last year did a video to promote what was going on in conjunction with Hunt's Community Cancer Network, who are also using some of the equipment. And I think from the senior manager's point of view, that was showing what a fantastic job that actually the council are doing for the local residents, and they've obviously been a keen advocate of that. And at Managers Forum, one of our recent Managers Forums that we promoted there, and shown to all the managers to say, look, as a council, look, this is what we're doing. And the council are very keen to, if you've got a good project, to show it off, show other members of the council, and then they can get on board or might get another service involved. So obviously through Kevin and Joe, my line manager at Hunts District Council, we take our well-being of our local residents quite seriously. So obviously we want them to grow up and live in a place which they enjoy living. We also want them to be physically active and physically able to do those things. So obviously we looked at a lot of the data, and obviously, as I've mentioned before, a lot of people are living longer. And there's several people with long-term medical conditions, and they may have more than one, which is obviously even more difficult to manage. So if we can help them be safer, or not safer to a degree, but obviously feel better, and encourage them to obviously keep that pathway open, then obviously they're going to enjoy living in the surroundings and be able to utilise what Huntingdonshire and the area has to offer.
At that kind of grassroots level, we've got the enthusiasm going. But as we bring things up into the organisation in its widest sense, then you start to kind of run up against some of the current ways of doing things, and so you've got to spend a lot of time and effort helping people to understand why they want to change doing things in certain ways, or gaining their input, because this is not part of their core work.
We got approached actually a little while ago by two of the stroke consultants at Ipswich Hospital, who said they were interested in seeing if we could bring telemedicine, so video conferencing telemedicine, which is similar to FaceTime or Skype, people are quite familiar with that, sort of earlier in the stroke pathway. So if the paramedics had the ability to link in directly with an expert stroke consultant, when they were presented with someone in a pre-hospital setting who wasn't a straightforward stroke. Lots of stroke patients are fairly straightforward, and paramedics are excellent at assessing and making a decision about patients. But we know from their data that up to 50% of those patients are what we call stroke mimics. So there's many other diseases and illnesses that can mimic a stroke. Something like what's called a hemiplegic migraine, so a very serious headache that can cause weakness in one side of the body, mini stroke, Bell's palsy. So there's lots of other conditions, and actually a lot of those patients get taken to hospital and even get admitted, sadly, when they've got something relatively straightforward that doesn't need hospital care, but maybe they need to see their primary healthcare provider, nurse practitioner, GP, whatever. So the thought was, if we could give the paramedics the ability to link in to the stroke consultant when they needed them, i.e. within the patient's home or in the office, wherever the patient was taken on well, we might actually be able to improve the diagnostic acuity, so improve our stroke diagnosis earlier on, which means senior clinical engagement when you're trying to do anything with telemedicine is really important. And if you can get consultants on board early on in this project, which is what happened, and we've got the senior paramedic lead the stroke in the area on board, who we link with anyway because of the stroke out of hours services, we liaise with the ambulance service, that's really key, because the less you can get those people on board to be able to help this process get up and running. It's quite a strict sort of structure, I guess, and a lot of these areas are siloed very much, and that they don't always communicate with each other that well. So to be able to develop that sort of pre-hospital to secondary care link, you're sort of jumping over primary care, is actually quite useful. So engagement from everybody at the beginning. Just start talking to other people who've done it. I mean, start networking, see if anyone else has done the same thing, because you might learn an awful lot from other people, and mistakes that they've made, or barriers that they've come across, or issues that they've come across that you haven't even thought of. So I think being able to network with other people, and certainly part of this Digital Pioneer has been really useful to see, whilst there have been different projects, actually they often have a similar theme to yourselves, like barriers, middle management, whatever, people actually using it. And it's also about training and education. I think people often think, oh my goodness me, it's all, got to press lots of buttons. And I think if you can make it very easy, which our software is, it's actually very easy to use. You saw me earlier, it's literally 2 clicks and you're in. Then people are much happier with it.
By using a different methodology, that you've discovered other things in your system that require effort. So what I've heard you say is that there's something around, we need to change the way people can deal with things in terms of care. So actually they're going to be, so that's an upskilling in terms of people on scene. There's something around different ways of doing things on scene. And then I think I also heard you say, perhaps earlier, that there's something about actually learning to use televisual approaches in terms of consulting. Can you just talk a little bit about what that's raised then?
So many years ago, we used telemedicine. I was in a nurse practitioner, nurse-led clinic in central London, and we were part of a research project linking with a hospital in Northern Ireland to support a nurse-led clinic. And what we discovered was it was very different doing a telemedicine consultation than a face-to-face consultation. And we had what we call a triangle. So it was the consultant in A&E, it was the patient and ourselves, so that the patient was very much involved in that process of the consultation. It wasn't just us as a nurse talking to the consultant in A&E. We were showing them, actually most of it was wound care that we were asking for specific advice on. So it would involve the patient talking to the doctor, and in fact we found the patients were really happy to do that, and that they had a consultant on the end they could talk to. That's fantastic. One of the issues we had was the nurses hated seeing themselves on camera. As you know, with Skype or FaceTime, there's a real small image in the thing. Some of the nurses wouldn't do it. They found it really difficult to see themselves on screen, and I get that. It's really hard to do that, but it's kind of something you got over. So having kind of a 3-way consultation with somebody who's virtual and not in the room actually changes the way you consult, because you become their hands by proxy. So they can see and they can hear, but they can't feel. So even things, I'm going back to my early days as a nurse, feeling if a wound is hot or not is really interesting, because that gives, maybe that's an infection. We were at University of Hertfordshire, we were one of the pilot projects for the emergency care practitioner programme, now called paramedic practitioner, I think it's a different name. And it was an 18-week course, and the paramedics were qualified paramedics but had never been to the university before, so it was a whole new process for them. And our original agreement with the ambulance service, they would be released from their lines, what they call their lines when they're on duty. And we were hearing that one of the managers had decided that they were working over Christmas, our course ran over Christmas. And I said, no, you were to be free to study. That wasn't part of the deal. So the paramedics were very worried they weren't going to get essays written in time. So I said, well, I'll see what I can do. So I phoned, I've always been a bit naughty and just go to the top. So I phoned the Chief Exec Secretary and said, could I have a meeting with him just to discuss the issue? I'm hearing stories, let's just get the answer from the top guy. So she said, yes, can you come tomorrow? So Chief, that's fine, no problem. So I went back into the room and after coffee break, and I said to the guys, it's fine, I'm going to sort out, there were some girls there, but no girls, I'm going to sort out the problem, that's fine. They said, Lynda, you won't, it's this ops manager, he's being difficult, blah, blah. I said, no, I've got an appointment with the Chief Executive tomorrow at 11 o'clock. And there was silence in the room. You did what? I said, just go to the top, just get it sorted. And he yes. So I went to the meeting with the Chief Executive, and this was really interesting. And I walked in, oh, yes, lovely to meet you, I've heard about the programme. And I said, we just have an issue with these guys being released over the Christmas period. It's not a problem, not a problem. Now, it was sorted within 5 minutes, but what he then wanted to talk about was we were setting up a critical care paramedic course. and it was linking with the ambulance helicopter, and he wanted to know about that. So it was really interesting. On his, it was a done deal, but someone further down was putting a block on it, and the message was just not getting through. So it was just removing that blockage and getting that, and that was sorted. We're also doing that. We've also used the software here in Addenbrooke's to start a virtual outpatient clinics project. So patients having a consultation at home who are well but are housebound for whatever reason or too poorly to come to the hospital. We're a tertiary hospital, so we have lots of specialist service, and we ran a 3-month project which went very well, but we now have a barrier with very senior executive management who feel that there's going to be a burden on our network capacity. Again, comes up as an issue. It won't, but it's difficulty in persuading those individuals that things are, and we're changing provider, which is complicating the matter in terms of IT infrastructure, so it's a much bigger issue than just our project.
So definitely do it. There's a lot of change that needs to be made, and digital change is easier than people think. I think it's just getting over the natural resistance to it. It's a really good project. It's a really good system. It's nice to be able to see other groups of people and other companies that are going through the same issues you are and have the same problems you do.
The feedback from the staff, they've really enjoyed having an app that's much more user friendly, and I think one of the most surprising things that we've then found is that with staff who weren't comfortable with the concept of mobile working, by the fact we've been able to go out with them, they've actually got the concept of mobile working as a way of working clinically, and then being able to use the app to do their notes. So they're able to see their patients in the records and make a much better informed clinical judgment right away, rather than having to go away and look at notes and come back. We had a clinician who went out to see a patient, they'd fallen over, so they then called 999, and when the ambulance arrived, the clinician was able to give all of the information to the ambulance crew, who then were able to make a decision that it wasn't needed for the patient to go into hospital. They'd got a GP appointment the next day, and we stopped an unneeded hospital admission. And that's just one anecdotal story. One of our clinicians who, because of being able to use the app, could see what was going on with her patient. She could see which GP was involved with the patient. She could see that he was becoming very unwell quite quickly. So she was able to send messages to the GP to say, he's unwell, he needs to be on this medication. I can see from what's happened in the past, this is what he needs. And actually, that was in the morning. The patient started the medication in the afternoon. If we hadn't got that system in place, it would probably have been 12, 24 hours later before the treatment would have started. So the patient would have been much more ill. This one clinician, after using the app for a week, gave the most amazing feedback. She said her children had said, we have our mummy back, and her husband said, I have my wife back. Make sure that clinicians don't feel IT is scary. So another example is where one of our trainers was out with a team, and 2 or 3 of them were saying, the app's amazing, that's brilliant, I love it. And some of the other team members were laughing and joking, saying, and you don't normally get on with IT, you don't like a laptop, you don't like the live system, but look at you now. So it's been making it accessible and non-scary and non-threatening, so that clinicians actually feel like it's helping them with their work rather than being a hindrance.